January 20th of 2022, I was 28 weeks and 1 day pregnant with my daughter Ruby when I arrived at the Washington Surgery Clinic in Washington, D.C. for my abortion appointment. I paid the nurse behind the counter $11,400 in cash, and she said that that was not unusual. The nurse called me back to draw blood and perform an ultrasound, and she explained that the abortion would be a 3-day process, 2 days for dilation, 1 day for extraction. She assured me that Ruby would feel no pain before she passed away. I was recording undercover, so I thought that I would feel on edge, and I was interacting with people who provide elective post-viability abortions, so I thought that I would feel angry, but I didn't feel either of those things. I just felt heartbroken. When I thought about what I could legally ask them to do to my little girl, it was genuinely distressing, and I started crying. The nurse was kind and reassuring, but she didn't ask why I wanted the abortion or whether I was sure about my decision or whether I was interested in any other options. And at no point did clinic staff ask me anything about Ruby's health status, and that makes sense because the Washington Surgery Clinic will abort a 28-week fetus for no medical reason. In fact, both of the nurses I talked to reassured me that there was nothing wrong with or even unusual about me seeking abortion that late without medical indication. I went back to the waiting room where there were several other women, and I sat for a while and wondered what brought them here today and if they were okay. Eventually, another nurse called me back to give me medications before the first dilation, which included acetaminophen, some antibiotic, and Xanax. I asked if I could see Dr. Santangelo, the person who would be performing the abortion, before I took the medications, but she said that's not possible because he wouldn't be able to see me until it was time for the first dilation, and by then the medications would need to already be in my system. I asked her if the Xanax would affect my clarity of thinking, and she said that it shouldn't. I learned later that common side effects of Xanax include drowsiness, memory impairment, and cognitive dysfunction. I emphasized that I didn't mind spending more time at the clinic if it meant that I could talk to the doctor before medicating, but the nurse wouldn't budge, so rather than take medications before talking to a doctor, I told the clinic staff that I had changed my mind and I left. I have people on at least a weekly basis tell me that abortion of viable fetuses either never happens or happens only for medical emergencies, or I'm misunderstanding the procedure and it actually results in the live birth of a premature child. Countless people have also insisted that women who choose abortion do so with full knowledge and autonomy. I think people just believe what is comforting to believe, but my experience at the Washington Surgery Clinic was nothing like that at all.